Hello, it's Dr. Rhonda Johnson. Today is Monday, July 3rd, 2023, and today I'm talking about hand, foot, and mouth disease. But first I want to acknowledge that most of the information I'm sharing today comes from the Nemours Kids Health website. It's a very nice summary, and I'll include the link. So back to hand, foot, and mouth disease. What is it? It's a mild contagious viral infection, most common in children under the age of 5 years of age. Now, what are the symptoms? Well, symptoms include fever, sores in the mouth, and a skin rash. And the skin rash can be found on the hands, the palms of the hands and the soles of the feet, but it can be anywhere on the body, really, in an infant or child, especially if they have atopic dermatitis or otherwise known as eczema. Now, symptoms usually last for 7 to 10 days. Now, what causes hand and foot and mouth disease? Well, it's caused by, most commonly, a coxsackievirus. Have you heard of coxsackieviruses? Well, they're part of the enterovirus family of viruses, which includes polioviruses and the hepatitis A virus. They live in the human digestive tract. Now, in the northern hemisphere, they usually show up and cause problems in the summer. In the global south, they can be transmitted year-round. Now, they are very contagious. They pass from person to person on unwashed hands and contaminated surfaces. They can also be spread through droplets that are sprayed in the air when a person who's infected coughs or sneezes. Now, if there's an outbreak in your community, the risk is greatest among infants and kids younger than 5, and the virus spreads quickly in group settings such as schools, child care centers, and summer camps. So what can you do to prevent coxsackievirus infection? Well, there's really no vaccine, and hand washing is the best protection. Now, disinfection of shared toys in child care centers should be done because the virus can live on these objects for days. So how do you know if your child is getting worse? Remember, most infections will be mild, but if your child is showing signs of drowsiness, trouble feeding, decreased urination, high fever, or severe skin infection, or if you just think your infant or child is not looking or acting well, either call your doctor or go to the nearest emergency room. So that's my message today. I hope it's helpful. Be prepared if you have a child between the ages of infancy and 5, particularly if they go to a child care center, to watch out for coxsackievirus and hand, foot, and mouth disease. Be well, folks, and happy 4th of July to all the folks who celebrate Independence Day here in the United States. Take care.